the real developments shaping the future of medicine and innovation. We look at what's actually happening on the ground, the science, the clinical progress, the capital, the risks, and the opportunities. Each episode takes a clear eyed look at a different topic. Today, we're focusing on the current state of neurotechnology. Neurotechnology is moving fast. Just this week, companies showed real time thought control of computers without penetrating the brain, while others advance clinical implants and vision restoration devices. But one of the toughest remaining problems is still getting those implants into the brain cleanly and keeping them working longer. Actuated Medical, led by Dr. Maureen Mulvihill, is focused on exactly that challenge, using motion based tools to improve insertion precision and implant longevity. Today, we're joined by Dr. Mulvihill to talk about the practical engineering and clinical realities behind the progress we're seeing. Before I bring Dr. Mulvihill on, I just want to have a really quick disclaimer. I just want to say this. I'm speaking in my own personal capacity only. Nothing on this podcast constitutes investment advice, a recommendation, or an offer to buy or sell any securities. The views expressed are my own and do not represent those of any firm, client, or employer. Topics discussed may involve significant scientific, regulatory, clinical, and commercial risks. Past performance is not indicative of future results. Always conduct your own due diligence and consult qualified professionals before making any investment or medical decisions. This content is for informational, and educational purposes only. All right, let's get into it. I'm going to bring Dr. Mulvihill on. There she is.
Hello.
How's it going?
Yeah, great. Thanks for having me. I'm so excited to be here with you.
Absolutely. So, before we get into like the meat of general topics and all that's entailed in the industry, why don't you go into your background and kind of what you're currently doing?
Sure. Hi, I'm Dr. Maureen Mulvihill, and I'm President and CEO of Actuated Medical. I'm also a recognized leader in the medtech industry as I hold board of director seats on AVMed Excel, and Life Sciences Pennsylvania. But I lead a team that is transforming how we access the brain to improve outcomes. The company was started about 20 years ago. I was sitting in a doctor's office and we were talking about clinical needs. And he said, my patient has about 6 hours to get to that blood clot before it has brain damage. And I went back and I said, okay, we need to develop medical devices. And so that's why actually it was founded on the idea of putting motion into medicine. So everything we do moves in such a way it enhances the procedure.
Amazing. Thanks, Dr. Mulvihill. I guess like my first question is just general question. What does it actually mean to understand the brain like fully?
So the brain is like the last frontier, right? It's an organ that's very hard to access. It moves away. It moves. It has different layers, so it's really difficult to access. But it holds the key to many of the illnesses that people have. So we can treat neurological conditions if we hit the right target in the brain. So the brain is just fundamental to our health.
Wonderful. And do you feel like the brain is more of a computational system, a biological organism, or something that transcends both frameworks, essentially?
Oh, it transcends both, right? So it's controlling how we're moving, how we're seeing, all of that. But it also is just an amazing piece of, we'll say, amazing piece of equipment that really needs to work properly.
Absolutely. What are your thoughts on like the current like trends and like how do you feel about Neuralink, for example?
Yeah, so there's a lot going on in the neurospace right now, right?
Yeah.
So we have people that are using deep brain stimulation probes to access deep brain targets to control Parkinson's. So if they hit that target precisely, they
Yeah.
can stop the tremors, and so that Parkinson's patient can now eat soup again or button their shirt again where they didn't have that before. And then you have all of these other technologies that give somebody back their mobility or give somebody back their eyesight. So there's just so much going on in this space right now. And you do have companies like Neuralinks and BlackRock Neurotech and Paradromics that are also at the edge, really trying to give people their mobility back or giving them some sort of thing that they've lost,
Yeah.
bringing it back.
What would you say, like, in terms of us understanding the brain? What percentage do you think of the brain that we fully understand, or what do you feel like? Like, how far are we to the point where we understand fully the brain?
Oh, we're not even close, right? The brain is just this amazing organ, as I said before. But I mean, we've been studying it. So the Brain Initiative started like 20 years ago. And so they really are trying to figure out the pinpoint the areas in the brain that control depression, that control Parkinson's, to control epilepsy. We're still trying to understand that. So if you think about epilepsy and they're doing epileptic mapping, so you have a patient, they're having seizures, they don't really know what's misfiring in the brain. So they put multiple different electrodes in there, maybe like 10 to 15, and they watch that patient over 4 or 5 days to see what's misfiring. And then if they find it, they can make a game-changing improvement in that patient's quality of life. But it's all about understanding what's going on. So
What
we're putting a
percent?
good.
What percentage of like complete knowledge do you feel like we have? What
Oh,
percentage?
I would say probably 10 or 15%. I think there's a lot more for us to learn, right?
Yeah, interesting.
Yeah,
Um, that's wow. We still have a long way to go with
we
that
do.
stuff. And like, do you feel what's like a genuine like scientific explanation of consciousness in general? Like, what do you feel? Is there like a real definition of it, or do you feel it's still kind of one of those dubious concepts?
Yeah, I would think from my personal opinion on that, that we don't really know, right? Those are things that we're trying to figure out and understand. And maybe that's the other 90% of the brain that we haven't figured out yet. But it would be
Yeah,
interesting to control consciousness, right?
yeah, and yeah, like where does it come from? Like that's always been like a question, right?
Right.
Where does it really come from? Like, do we don't really have any scientific. I mean, we have some scientific theories on that, right?
Right.
But
Well, I think there's almost scientific. There's people that, they believe in the body as the holistic part, right? So if we can understand what's going on, so you put all the pieces together and yeah, you control it, right? Right? You understand it, but it's
yeah,
all related, right? So we just have to figure it out. We just
do you
don't know
feel like
yet.
do you feel it's possible that our consciousness is not attached to our body?
No, I don't personally believe that. Do you believe that?
Not necessarily, but for example, if like for example, if there's a heaven, right? Your consciousness would go to heaven. It would separate from your body, if in the afterlife. Um, so you know, I don't know. This goes into like really esoteric fields of
Right,
like
for sure.
soul and like
Right.
afterlife and things like that.
Now you're
Um,
beyond my education level because I never studied that. So I don't
and
know. I'm sure somebody
yeah,
else could get on the podcast next week and they might jump into that and go forward.
yeah,
I
yeah,
don't
yeah,
know.
for sure, for sure.
Yeah,
But you do have a PhD
I do.
in and that took you, you said you were just talking about it 5 years or 7 years with a master's degree.
Right.
Why don't we go into like more industry stuff? How has the convergence of neuroscience, engineering, and computing changed in the field in like the recent years?
Oh, it's significant changes, right? So we have AI, we have robotics, we have all these different understanding of the brain. Like I said, the Brain Initiative has done incredible work in the last 20 years to pinpoint various targets. So pulling all of these different groups together, we have I always say it takes a village to get something done. And it really is. We're bringing the village together to treat neurological conditions. Because if you think about it, right, there's 100 million people out there that have some sort of treatment resistant neurological condition. So it's a huge group of people that need our help.
Absolutely. What do you feel like? What groups of people, niche groups of people, or subsectors are seeing the most momentum right
Well,
now?
we think about deep brain stimulation probes been treating Parkinson's for over 20 years. But now it's FDA approved for epilepsy, OCD, tremors, and it's being clinically investigated for treatment resistant depression. So if you think about that, that's a lot of people where DBS can make a big change for them. And I
Yeah,
mean, from a personal standpoint, my father-in-law died of Parkinson's. So Parkinson's to me is something that's very, pulls at the heartstrings. I really want to make a difference. And for him, when my daughter was 2 years old, he'd put her in this little rubber bucket. He'd swing her around the living room, and the two of them would have a great old time. But just 2 years later, when my son was ready for the bucket ride, my father-in-law was not confident in his strength to lift his grandson around and fly him around. And that was just 2 years. That's how much it was degrading his mobility and whatnot. But we watched him decline for 10 years before he passed. And so
Mm.
us ensuring that DBS is out there and is more precise and can help more patients really, is pulls at my own heartstrings.
Yeah, I feel like people that become like severely depressed,
Mm.
they're just a different version of themselves usually. And I think we've all been depressed to some extent. And can you speak to like the the concept of um, most people thinking, or some people thinking, that you could just work yourself out of it, or you can just work out or eat differently, or whatever the case may be, and
Right.
it will just become healed, or you'll be much better.
Right. Depression's not something that you can, it's a biologic, right? So, and they
Yeah.
know that now because it's being clinically evaluated for deep brain stimulation. So, if you could put an electrode into the brain and turn on a little current and stop that feeling of depression, that means it's a biological issue with the human. So, it's
Mm.
not something that they can just give them, some works give them a drug, it'll work, right? Give them a little pill might work, but there's a significant number of people that just doesn't work anymore. And by using a DBS probe, now this is still under clinical evaluation. There's been over 100 patients that have been enrolled in that study. But one of the key people that I met at a conference about a year ago, he talked about thinking about committing suicide hundreds of times a day. And
Jeez.
once they gave him that DBS probe, turned it on, he woke up, and they said, "Do you want to play with your kids and walk your dog?" And he said, "Yes." So it was game changing for him. And
Yeah.
he's now out there advocating for this technology for so many other people that have treatment resistant depression.
Did he like give you an explanation, or give anyone an explanation as to why he felt he was depressed? Like, most of us, if we're depressed, we're going to say, well, financially, I'm not doing so great, or I just had a passing in the family, or whatever the case may be. Was there like a general explanation in his own mind why he was so depressed?
No, I
Or
don't think he knew why he was so depressed, but it
really?
was, like I said, he was contemplating suicide hundreds of times a day, and now he's
Jeez.
enjoying life. So, and he did everything out there. They made him, before he could enter that study, he had to do all the pharmaceuticals, all the different procedures. Nothing worked.
Jeez. So like, wow. So how do you get to the point where you're like, well, I need to try something different, or being open? Is it just you're just so you have no hope, and you think, I'll
Right.
just try this other technology? Or how does somebody even come across DBS surgery?
Well, I think there's a lot on the internet now. I think you
Yeah.
Google. I mean, you can see a whole bunch of YouTube videos with him on it, right?
Yeah. Yeah.
I mean, you can Google DBS, and you can see videos of people with Parkinson's talking about how they can button their shirt now, or they can eat soup again, right? But then you can also see people like this gentleman I was mentioning, where he talks about his depression. And
Wow.
that's why we do what we do, right? It's all about the patient. So neurotech is not simple. We're going into the brain. The brain is very complex. It has multiple layers. It's heterogeneous. But when you think about, wow, we can help these patients, let's make a difference. That's why we do what we do.
100%. 100%.
100%.
Yeah. So like, for me, like, if you initially see DBS surgery, how do you how do people get past that point of, does this really work? Would this really work for me? Because maybe they've like tried other medication, they've tried
Right.
medication.
It is treatment
Uh,
resistant, right? They've tried a lot of things and nothing worked, right?
right.
And then the doctor
And so,
says, why don't you try this, right?
yeah. Hmm. And if nothing else worked, like why would I, you know, I'm just trying to think through the patient's eyes. Like, why would I think this would work, or why would I be excited about something like this to work? I mean, it obviously works, right?
Right.
We're not making any claims, but this so
Well, it
like,
works for some people, right? You have to hit the right target and everything has to
yeah,
work. But yeah.
yeah. Um, what do you like? How do you feel like the entire industry is getting involved, and kind of facilitating this technology? Do you feel like there is enough backing from industry, or do you feel there needs to be a lot more? Like, how do you feel about the current support it currently gets?
Well, I think it takes a village. I've already said that, right? So
Yeah,
you need the large companies pushing forward with AI and positioning and targeting and whatnot. And then you need those small companies like us doing the innovating because we're working a little bit faster. And then you need the investors. And you also need the scientists, right? So you need those neuroscientists trying to understand the body and say, okay, we need to target this place in the body. And then, like I said, you need to have the small companies doing the tools and the devices, and then the big companies really driving it.
yeah.
Then you have to have also the manufacturing. You need to understand that. You need to understand the regulatory piece. It is a village, right? We cannot do it alone. We need to work together.
I always say like it's so complex. Like the med device industry is extremely complex. There's so many players. It's much different than most other fields, and that's why everyone needs to support, or all industries needs to support. And it's
Right.
very difficult. Like it's such a challenging thing. Like, can you tell me about like what it was like starting the company and um,
Mm.
actuated medical, and you know what your like ups and downs have been?
Oh, ups and downs. There's probably a few of those, right? I always say it's like a roller coaster, you know.
Yeah.
Is a roller coaster a fun roller coaster today, or is it not a fun roller coaster today, right? I go back to the patients. What we do is for the patients. So we have actually developed two other devices before our neuroglider system. So we have a device that clears feeding tubes while the tube remains in the patient. It is FDA cleared, has 5,000 uses. The first patient was actually at Walter Reed. So not only did we help a human being that day, we helped a soldier, somebody injured for this country, which was quite an emotional day for her because we're actually in rural Pennsylvania too. So it was really emotional. So then during COVID, there was a pediatric patient whose feeding tube had been clogged for 8 days. And as a parent, you're like, what were you feeding that child?
Yeah.
But anyway, we overnighted the system to them. We trained the doctor. I talked to him and I'm like, just giving him a lot of advice. And about 2 hours later, he emailed and he said, we cleared the tube. You saved the child from surgery. So when you have the down days, those are the up days, right? So that's why we do it. But I think along the way, as Actuated has really gone from a concept development company to we actually manufacture our own devices here in central Pennsylvania. So we do everything concept all the way to manufacturing and then a little bit of sales on the end. So I would say the biggest issue is probably cash flow, right? I think every small company, I have an incredible team here. I want to make sure my team is it has family sustaining incomes, right? We want to make sure everybody's covered. And then
Mhm.
we want to grow and we want to help patients. So we've done a lot with what we call non-dilutive capital. And so the United States government has a program called the Small Business Innovation Research Program. And
Right.
we've done a lot of those grants. So we've done a lot that have funded the medical devices that we've developed along the way. So the first one, Tube Clear, was funded with National Institute of Health and National Science Foundation funding. And then our other device slides onto the end of an endoscope, and it will say it has like two little fingers that helps them manipulate tissue during complex colonoscopy. So these are patients that have cancerous polyps in their GI tract, and they want to remove those in one piece so you don't worry about the cancer reseeding.
Mhm.
Once again, that technology was funded with that Small Business Innovation Research grants from NIH. So those types of programs. So I think your issue really is funding, right? So bringing in the funding so that we can really commercialize and help patients.
Yeah, yeah. So from like an investment perspective, to investors, like how do investors assess the overall investment attractiveness of neurotech compared to like other life science areas?
Yeah, I would think that they would assess it in a couple different ways, right? Does the technology have patents that surround it? Does the technology have key opinion leaders or clinicians, or in this case, neurosurgeons that support it and say, yes, this is a problem? Is there some sort of regulatory pathway that's clear? Is it a 510K pathway? Is it a PMA pathway? Is it a breakthrough device? And then that reimbursement, that's always key because when you get to the hospital, somebody's got to pay for it. So do you think insurance companies are going to pay for it? Do you think CMS is going to pay for it?
Hmm.
Those are the types of things that investors need to be looking at. And then, of course, the team, right? Can the team deliver? So,
Yeah.
yeah.
Can you give me like a great example of academia, startups, industry coming together
Oh,
and driving progress.
yeah,
Maybe,
I
your
would say your
company in
yeah,
general.
yeah, I would say your example's actuated, right? So,
Yeah.
so actuated, we think of an idea, we talk to clinicians, we do our research, we write the grant gets funded. Our subawardee is usually an academic institution. So we have great partnerships at University of Pittsburgh, at CMU, at Oregon Health, lots of places, right? So those academics are doing the science to understand what's going on in the brain, but they're also helping us do the preclinical work because as a small company, we don't have the preclinical labs here. So we have to partner with places like Penn State or University of Pittsburgh to do that, support us that way. So let's say the academics are doing the science and they're doing the preclinical studies that we need to have done, or even the clinical studies that need done. And then on the for actuated itself, as I said, we do the development and we do the intellectual property development. But at the end of the day, we're looking to find a strategic partner to do the high end commercialization of these technologies.
Yeah, 100%. And like, so just so for the listeners and the people watching, in terms of the technology itself, actuated medical, what specifically does the technology do? I know it's an insertion device, but do you want to explain that a little bit further?
Yeah, so when you insert devices into the brain, so you have AI systems and you have robotic systems, and they do the targeting, they do the planning. But as
Yeah.
you insert the DBS probe or the whatever type of implant you're putting in, as soon as you start going in through the tissue, you have a tissue interaction with that. And so sometimes that device deflects as it goes from one layer of brain tissue to the next layer. But our technology uses electronically controlled motion. So we're going down through the tissue more precisely. And as we go through each layer, we're not deflecting like they did if they just manually inserted it. And so our technology improves the insertion, improves the trajectory. So we hit the target, but we also maintain the channel on the way in. So we don't have any out of lane wobbling. So there's no
Yeah.
chance of like fluids coming back up if you were doing a gene therapy infusion or an addiction treatment therapy or something like that. So we're just increasing the precision of these devices hitting the target.
What's the implication if the target is missed?
Well, so right now we understand various parts in the brain that control depression, Parkinson's, and whatnot. So there's a specific region of the brain they're trying to hit. If they miss that region, then they're not going to have, the patient's not going to have any relief from those symptoms. Or if they miss it by a lot, there could be some off target effects. So if you put in a DBS probe in and you're close to you're supposed to hit a target about the size of a small olive deep in the brain. So say you're close to the target, but you're a little bit off. So you might stop the Parkinson's shakes, but you could have some problem with speech. So you have
Hmm.
that off target placement. So if you hit it on right where you're supposed to hit it, the Parkinson's symptoms are gone, and the patient just has an incredibly better quality of life. If you miss it slightly, okay, they have a good quality of life, but they might have some off target effect. And if you miss it totally, well, there's not going to be any change in their quality of life. So we want to hit the target the first time. And even with DBS surgeries, there's been papers out there that say the 3 to 8% miss rate. So think about that. 1 in 20 patients has to have a second brain surgery because they missed it by too much. And
Jeez.
that's what we fix.
Yeah. Um, so, t- what is that? What is that experience like? So when the target's missed, they have to go in for a second brain surgery. I mean, it's obviously very unpleasant for the patient.
Very much so. And the family members, and the physicians, and the hospital that has to cover that second surgery, right?
Yeah. Yeah. So
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 it
so the
impacts
hospital has
everybody,
to, so the hospital has to cover the surgery the second time.
right?
So out of pocket, essentially.
Correct.
Um, wow. And
Correct.
um, so have you talked to a lot of patients that have had to go like into a second surgery, or like what has been your experience with that?
It's not a funny story, but a funny story, Frank. So I was at another conference, and I was actually at the happy hours right after the conference is over. You're in the happy hours, and I was talking to a friend I've